You're listening to Finn Voices on Healthcare Now Radio, where we highlight and amplify the voices at the forefront of health innovation. Innovation that improves people's lives. Join us for an inside look at the changemakers driving conversation and answering the most important questions in healthcare today.
Welcome to Finn Voices. I'm Beth Friedman, Senior Partner at Finn Partners, and I'm based in Atlanta, Georgia. Today, I'm super thrilled, honored, excited to have my guest, Mark Hagland. Mark is a nationally recognized healthcare journalist, speaker, former editor-in-chief of Healthcare Innovation magazine. We have worked together for more years than I can't even think about. He's one of the most authoritative voices in healthcare. It seems like anybody I talk to at trade shows, conferences that's in the IT space in health knows Mark, reads Mark stuff, loves his insights. So he's spoken at he's spoken to thousands of health system CIOs. I think I probably got that right. Moderated hundreds of panels across the country, and probably attended more health technology conferences than anybody I know. Mark, welcome to the show.
It's so great to be with you, Beth. It's an honor. Thank you so much.
Absolutely. Well, we're dedicated this episode to those big two letters in healthcare right now, AI. But we've talked about lots of IT pieces over the years, bits and pieces, right? Part here, part there, different parts of the IT stack, if you will. But really, I see AI as like the biggest shift, the biggest, almost more than EHRs back in the early 2010s, if you will. The stat I saw last week was that 46% of all health IT spending in 25 was for AI and AI solutions. So there's no going back now, right? So with everybody you've spoken with in the past months, past year, what are your thoughts about where we are as an industry with this?
Well, the thing is, this is kind of an amazing moment, I think, Beth. First of all, I'm just going to kind of try to blow everyone's minds and say AI is almost undefinable in a way at this point because it's being infused into everything. So if I say AI is not a thing, people will be like, wait, what do you mean by that? And what I mean is that we are now using advanced analytics for like just about everything. So to cover it is to like talk about the sky, right? Let's talk about the clouds and the sun and the sky. It's such a huge topic. And I think the key things that we need to realize are AI is changing the way healthcare is working. It's changing the way people are working. It's going to be necessary. It's very complex, and it's very hard to make very broad generalizations, except to say it is now becoming infused in everything.
Absolutely. And I know, we talked how at all these conferences you and I go to, of 3, 4 years ago, people were afraid, but no longer, right?
Let me give you an example. I've been covering RSNA for well over 30 years, just as I've been covering HIMSS for well over 30 years. 5 or 6 years ago, there was definitely kind of an atmosphere of foreboding or anxiety among many radiologists because they were first encountering AI and they kind of had a nightmare and scenario in their minds, right? Like it'll be all machines, there won't be radiologists. The Actually, the opposite has turned out to be the case. What we're finding now in the field of radiology, which is really one of the most tech-facing medical specialties, is AI is going to help the radiologists. And the phrase now is radiologists won't be superseded, won't be eliminated by AI, but those who refuse to use AI will eventually be eliminated. I saw this amazing demo sponsored by the American College of Radiology on the second last full day of RSNA, and it's very difficult to summarize, but basically, second year radiology residents using technological tools that are available now among various vendors. They put them together in a demo so that the totality of this does not exist, but the pieces exist, in which they were showing workflow for Dr. Radiologists a few years from now that incorporated algorithmic generative and agentic AI all at once. You almost had to see the demo to understand because it was very complex. But the bottom line is medical specialties are realizing already they can become far more efficient and effective and get clinical decision support that would take a long time um, to help them with and all in one place. And that's the single thing I'll say about medical specialists. They're so time crunched and they've got so much data and information, radiologists, cardiologists, etc., that AI is going to help them a lot.
You mentioned cardiologists, so one of my clients works in that space as well, and you're absolutely right. That's what we hear all the time. I'm so inundated with data, and mostly this company works with electrophysiologists, so they're the
Yeah.
ones that are monitoring all the data that's coming out of monitors, I guess, heart monitors, pacemakers, all those devices. Same thing, inundated with data, can't really see what patients need that critical intervention, which ones are okay, which ones I need to bubble up and get to the clinic this afternoon, right? So it really, I see, you're right. I see the specialties driving some things to really make better patient outcomes, but also to make their work more intelligent, more informed.
That's right. I wrote a blog recently based on an article that appeared last year in Frontiers in Physiology entitled Efficacy of Artificial Intelligence Based FFR Technology for Coronary CTA Stenosis Detection. That's the only half of the title.
A lot of acronyms.
I know. But basically, what this article was talking about was what's called fractional flow reserve from CT. What AI is doing is bringing the different pieces together for cardiologists in real time in ways that would take much longer for them and be more difficult. So there's an analogy or a parallel to what's happening in radiology because like radiologists, cardiologists have way too much data and cardiologists have inputs from various types of machines. So they also have that issue. So I think the future is bright, and I think that the people who were panicking, especially the specialists who were panicking a few years ago, their minds are shifting now.
I saw that at AHEMA. I saw it at HFMA this year, Mark. Billers, coders, same thing. It's going to take my jobs, right? It's going to be such a disruption to my work. But now they're like, no, no, I need this and I need it to do a better job at my job. And by the way, it might make my job more fun, more
Yeah.
productive. You know,
Well, and what it'll do, what AI will do is it will eliminate some of the most um, menial, uninteresting tasks, and it will give the remaining tasks will be the ones that require human thought and require human analysis. And I think that's going to be interesting. Just this week, Anthropic released
mm,
Claude for healthcare, and it claims now nobody knows, but the claims from the company are that it's going to really help make far more efficient prior authorization processes for providers. And again, we'll see what happens, but if that is true, that'll be a great boon for hospitals and health systems. They're having problems staffing up, in revenue cycle, and anything that they can do to make prior authorization processes more efficient, that's a win. There's no downside to that.
and coding and denials and all of
Exactly,
it.
exactly.
Well, we've talked about some specific progress we're seeing right now, right? We talked about some progress in cardiology, radiology, perhaps even rev cycle. But I do know, and I heard this loud and clear from you, is that the real beauty of all of this is what's going to come next. Is sort of how society in some ways will shift and the whole way of thinking around healthcare delivery will be different. And you and I talked about this, and I think you brought up horses, cars, and trains.
Yeah.
Tell us about what you heard at RSNA in that regard.
Yeah, there was a wonderful keynote that was delivered by a data scientist named Zeynep Tufekci. She was born in Turkey. She was so interesting because she said the bottom line of what she said, and she spoke for nearly an hour, so there was a lot of content. But she said one of the things that people need to do is they need to think differently about AI. And they need to project in the future, which of course is very difficult to do because the biggest changes are going to be actually at the societal level over time. So the horses, trains, and cars thing was really interesting. So when the steam engine was invented and then applied to train technology, and when the first cars, the first automobiles were invented, people were thinking in terms of horses because that's, in 1840, people traveled by horse-drawn carriage or whatever, and goods were trucked run by horse. So people were thinking in terms of what existed at the time, and everything was, will this be faster than a horse? That kind of thing. Now, of course, in the year 2026, we're like, wow, that's really weird to think that way. But she was trying to zoom this forward and say that's how we're thinking right now. We're thinking about current processes and will certain things just be made more efficient. One of the points that she made that was really interesting was before the invention of the automobile, work life was different. You really had to work quite close to where you lived, or you had to live close to where you worked. Even a couple of miles was a lot, and if you were outside the main cities and you were 5 miles away, that was hours away by horse. But what changed was then the whole work world changed because with the automobile, people could drive some distance in a short period of time. And so that nexus of work changed. Just like now, most of us are working remote, right?
Right.
And
COVID was the big disruptor for that for us,
that's
right?
right. That's right. Exactly. And one of the things that people um, need to do, Zeynep Tufekci said, is let's think, kind of play things out. How will this change locus? How will this change how work is done? And we still don't know, but we have to stop thinking in terms of the way things have always been. And one of the things I've talked about for many years in healthcare is there is still in some among some individuals in some organizations kind of a custodial mentality to healthcare administration and management and leadership. It's like keep the lights on. We've done X number of open hearts every year, so that's what we'll do. We've done X number of hip replacements, that's what we'll do. We've always had labor and delivery, that's what we'll do. And I think one of the things that technology is going to change is it's going to empower organizations that are willing to take it to the next level and really analyze what they do. And now, as we're moving into this incredibly um, payment pressured environment, hospitals and health systems are going to have to rethink what they do and where they do it and who does it. AI is going to help. All kinds of analytics are going to help. They need to rationalize their service. That's not the same as ration. Rationalize means think about it, right? Like we have 40 outpatient clinics in our metro area. Where are they situated? Does it make sense? Is that where people want to be served? Then you add in what the patient experience is, what our patients and their families telling us. So you put all these things together and you use analytics at every level. And I think that's going to be the change.
To really think, the title of our podcast today is to think bigger
Yeah.
about AI. So think about, how can it help you as an organization really plan for the future?
Yes, that's right. And again, to not just be stuck in the mentality of the past. Let's just keep doing what we've been doing because we've survived. I don't think that's going to work much longer. Payment patterns are changing, and it's going to become very difficult for organizations that don't have leadership that is thinking into the future.
To your point about, like you said, back when the horses and cars, they measured the car based on could it get there faster than a horse?
Yeah.
And that was short thinking,
Yes.
because we don't think about that now, right?
Yeah.
Horses
No,
don't,
nobody thinks
horses.
about horses unless they have a horse farm or something like that, right? Yeah.
I love horses, however.
Yeah.
If you came to my
Yeah.
house, I have horses everywhere.
Yeah.
But you're right. And like I think about it like with my background of coding, like now we're thinking with autonomous coding, how many more cases can we get coded? Well, let's think beyond that. Yes, we're going to be able to get more cases coded and faster. That's a given, right? That's where we are today. But what else? What else is there, right? What
Well,
else? What
and
other possibilities?
Well, and you know this, Beth, because you lived through this, but remember the old medical records office with paper files, piled up to the ceiling and filling large rooms, like very large
Yeah.
rooms,
And
people
basements.
going through, right, yeah, exactly, and basements, and going through the paper files. All that is gone. So the people who were file clerks, I mean, no dissing of them in any way, but people who worked as file clerks, that doesn't exist anymore. It's just like anyone who's advocating for the buggy whip industry. It's gone now, right? And I think that's one of the things we have to do. We have to think
Yeah.
about what are the jobs of the future. This is why so many organizations are now hiring or promoting people to be chief innovation officer, for example, chief patient experience officer, all these new titles. The challenge, as someone who's a friend of both of ours has said, Pam Arlato, who's wonderful, you can't think in old ways and just put people in new positions. You just can't take like one harried nurse executive and make that person the chief innovation officer, right? Like Susie is now going to innovate for the whole organization. So the organizations that are doing well are the ones who are thinking about technology, and that includes AI, in in innovative ways. They're not just saying, let's do things faster, that kind of thing. They're thinking about what their organization does. Like, what do we do? It sounds very existential, but what
Mhm.
do we do and what should we be doing?
Yeah, that was one of my questions I wanted to ask you.
Yeah.
You have interviewed so many CIOs. I know, and I introduced you to a few over the years.
Yes, you have.
Um,
Absolutely.
you've interviewed so many CIOs. You've attended so many panels. You've been to so many
Yeah.
sessions. I think you and I sat together at the HIMSS AI
Yes.
pre-conference summit last year.
Yeah.
Um, you've seen the good, the bad. You've seen the
Yeah.
mediocre. You've seen the stellar. The CIOs, the chief innovation officers or chief information officers, let's use the acronym either way. The ones that get it, the ones that do it right. Give me a few other best qualities that they exude that you see.
Well, what they're doing is they're lifelong learners working in learning organizations, right? That's the most fundamental. There are CIOs, and of course, no names ever, right? There are CIOs who are just trying to run out the clock, just keep the lights on, just make sure the cables are all connected, that is not where things are going. And the CIOs who are doing the best have the respect of their C-suite peers. First of all, they're considered part of the C-suite.
Right.
And when they speak, it's not just, oh, Joe is going to tell us about applications, right? Like we're getting way past that now. It's Joe is going to give us a vision of the future, or help us translate our vision of the future into what that means. So Joe still needs a technological knowledge base that won't go away. But what Joe or Jane are now doing is so far beyond that. They're not just buying apps anymore, right? And they're not just buying hardware and making sure the data center is not melting down and things like
Right.
that. They're really having to think. They're sitting with the C-suite. Maybe there's a C-suite or a board retreat, and everyone talks about, oh, well, this is where our organization has to go in the future. And they're immediately thinking, okay, what does that mean? How do I translate that? I'm not just a buyer of technology anymore. And so the best and the smartest CIOs are already thinking way ahead. That they have a technological knowledge base, but it doesn't end there. If it ends there, they're really now sub CTOs at this point. And we are seeing CIOs some CIOs kind of being pushed aside a bit, in favor, in some cases, it's CMIOs who are really becoming the stars because so much that has to change is clinical. And also they're getting these organizations are hiring chief transformation officers, chief innovation officers, chief data analytics officers. And they're saying, "Oh wow, this person is a thinker, right? They're not just working with technology. They're thinking about whole systems." One of the things I've been covering for the last several years is this whole concept of the door, right? And how we need a digital door. Well, okay, but then you find out that there has to be something behind the digital for it to work. And the organizations that are really creating a whole experience have all the leaders sitting together and thinking together, right? Yes, technology is a part of the digital front door, excuse me, but that's not everything. It's all processes and systems. And in fact, organizations that have done really well with the digital front door, one is the Nomura's Children's System for Health. They're way beyond just like what technology do we put together. It's really about the whole system and systems thinking. How do we and there's no question that the most innovative children's hospitals and children's health systems are way ahead because they have to think about the whole family, right?
Right.
If your patient is 2 years old, obviously you can't do a patient survey, you know. Um, so you're dealing with the whole family and what that dynamic is. So these digital front door initiatives are fascinating because what they inevitably lead to is this broad patient experiencing. And that again relates to AI. We're going to need to really analyze all these processes that relate to what is ultimately the patient experience. So it goes in many different directions.
It really does. It really does. And as you were talking about what the CIOs need to do and to think so much ahead, I almost have a new title in my brain. It's like chief futurist. Uh,
Yeah.
like
Well,
like
the
really
the
thinking
title
far
Chief
ahead.
Transformation Officer is a futurist role.
Hmm.
Yeah, absolutely.
Yeah. Yeah, for sure. Talking about futures. Wow, I've seen a lot of announcements this week, and I just saw somebody who's on one of my colleagues at Finn Partners is on location. Finn has a big presence there at JPM. And they said almost every single billboard in San Francisco was bought out by some kind of AI company. Uh, so the drive from the airport to the
Yeah.
hotel.
Yeah.
Um, a few nuggets I've heard so far, the chat GPT health,
Yes.
it's a big one. I have, my medical record background, right? I have a few issues about that from a privacy perspective. Like, do
Yeah.
patients know
Yeah.
what's happening with all this information? Either the physician's office is feeding the engine or they are personally feeding the engine. So gives me a little bit of worry, but tell me what you've heard, what you're excited about. Like, what do you think will really move the needle here that you've heard about this week?
I think ChatGPT will. I think the question, and I share your concerns too, because one of the I just saw a video blog, a vlog, I guess they call it, by a clinician, by a physician saying, okay, if we're going to do this and we're really going to empower, quote unquote, empower patients through ChatGPT, we better make sure that what they get is worthwhile, right? And not, because anyone can Google, the classic story, you start Googling, you find out, you have terminal cancer. Well, of course you don't. And multiply that like a billion times. I think what's going to happen though, I think this next level chat GPT and what might happen with Claude, those kinds of innovations are going to push providers and payers and everyone to say, okay, let's architect something that makes sense. Let's give patients tools, but they have to be responsible tools. We're not just going to let them go wild or let technology go wild and have them go into ditches. So I think it's exciting, but um, it's also sobering that so much technology is exploding. And I hope that the vendors will really be responsible in how they introduce this new technology because it could take a bad turn. And this physician who did this vlog was basically saying, we are going to have to regulate. We're going to have to do something. And what that looks like, you can debate, but I think a completely uncontrolled market probably isn't the best thing. Um, so we'll see what happens. I think, but as these vendor innovations just move forward really quickly, it's pushing providers and payers to say, okay, how do we harness this technology for good? How do we make this a good thing? One thing that I have found, and this is especially true in radiology, is patient care organization leaders are being very thoughtful in what they're implementing. They're not just wildly implementing stuff because others are. And so governance, data governance, IT governance is going to be a part of this.
I
And
think,
governance.
for sure. I think that's like that's where we've landed, right? Through the hype cycle and everything we've been through the past, I'd say 2 years, 3 years,
Yeah,
is the governance, transparency, the
yeah,
quality of the output, to your point. We
yes.
can't just be receiving googly goop and erroneous
Right.
data, erroneous
Yeah.
information. Absolutely. I'd like to see that actually as a focus.
And I
Um,
think your colleagues in health information management will be sentinel people, right? And
yeah.
who will say, wait a minute, let's not do X because that's not responsible and it could compromise patient privacy and patient safety.
Yeah. I hope you're right there.
Yeah. Whoever needs to rise to the challenge.
There you go. There you go. Speaking of that, the last challenge, and this is another one that I was reading about yesterday, open evidence. It's been around for a while. I know physicians. I think anybody with a national provider identification number can access it.
Yeah.
Um, I'm really intrigued by it. Really intrigued by
Yeah.
the technology. I have a new client that's doing something similar in their product suite with payers because, as you know, payers change their rules. Like, I don't know,
Yes.
on a whim, maybe.
Yeah.
Um, so like, they're looking to this same model and this same type of technology to pull out from all
Yes.
those new payer rules, what kind of things we have to look for in our prior auths or, in our documentation. What do you think about open evidence and doing sort of these supercharged clinicians, super
Well,
intelligent clinicians?
right. I think it's exciting. And again, I hope that people find really responsible ways to use it. I think responsible is the key word
That's
here.
the word. Okay.
Yeah.
Yeah.
Yeah. And clinicians, I mean, they went into healthcare to help people, right? I mean, they went into healthcare to treat disease and illness and injury, and they don't want to be irresponsible. I think some clinicians are going to personally put the brakes on things themselves. If they start using open evidence and they find in their own, whatever their medical specialty practice is, if they find it's kind of messing them up a little bit, they're going to
Mhm.
take a step back. And I think that will be somewhat self-correcting in that way, right? They
The
will
trust
also
factor.
complain. Yeah, yeah. They will also complain. Like if I'm just making this up, if 40% of radiologists find that a certain clinical decision support tool is putting them in the wrong place mentally, you will hear about it. So I think there will be some self-correction.
Yeah, you're right. You're right. Look, appreciate that. Well,
Yeah.
Mark, we're at the end of our time today. Thank you so much for being on our podcast. We really appreciate it.
Thank you,
It's
Beth.
called Fin Voices, and you are one of the most important voices in our industry. So
Thank
I
you.
really am honored to have you on the show. You can reach Mark on LinkedIn, and I'm going to open this up. I don't know, Mark, meet him for coffee at the Starbucks anytime you're in Chicago.
Yes, that's right. Anyone who can make it to the north side of Chicago or even downtown, I'll be glad to meet with them. But Beth, thank you so much. I really appreciate that you're doing this series and that you're talking to a lot of people and getting a lot of voices because that's how we move healthcare forward. Everyone has to be in it together for the right reasons and with the right spirit.
Absolutely. Well, thank you, Mark.
Thank you.
This has been Beth Friedman, Senior Partner at Fin Partners. I thank you for listening to Fin Voices, where we talk about health information, health innovation, and all the technology in between. Until next time, wishing you all the best in health.
Fin Voices is brought to you by Fin Partners, a global marketing and communications agency working across industries and services. Whether inside our walls or on the front lines of health transformation, we stand together to create meaningful and measurable impact for the world around us. Learn more at finpartners.com and follow us on LinkedIn at FinPartners.